We are going to discuss about the diagnosis of appendicitis. What is the importance of timely diagnosis of appendicitis? From the statistics, it has been found that a delay in diagnosis or a delay in surgery more than 36 hours, that increases the risk of perforation by 15%. That 15% of those patients in whom the diagnosis or the surgery after the diagnosis is delayed, the appendix bursts inside the abdomen and all the pus, everything spreads in the abdomen or can remain localized here but increases, and this puts the patient's life into a grave danger, much more than if we had dealt with appendix at an early time. So usually the age where it presents, in the previous talks we have discussed the signs and symptoms, and these signs and symptoms are the basic things that will make a clinical possibility of appendicitis. Now in addition to this, now we will have our mental workup of ruling out other conditions which can present as appendicitis and proving the diagnosis of appendicitis, documenting it before we take up the patient for surgery. Now there was a time earlier when it was commonly said that when there is doubt, the appendix is out. Now this dialogue that when there is doubt, the appendix is out, and nowadays we are doing this appendicectomy surgery and making the diagnosis. Every type of surgery and treatment we are doing by establishing the diagnosis. So now how do we establish the diagnosis? Number one is that we, by the process of clinical examination exclusion, try to be excluding all the other possibilities and try to see that we are dealing with appendix only. So we have to keep these things in our mind. Try to exclude any other possibility other than appendix, and ruling out those things is very important, that if we remove the appendix and patient is suffering from some other disease, that will not get addressed and we will be misguided. So what are the other possibilities? That is called differential diagnosis. Since the appendix is common in teenage group and young age group, I will take first in the groups where it is more common. Like one of the common problems in case of girls in reproductive age group. Now, after menarche, the girl becomes a lady, she is able to conceive, she has fully functioning internal and external genital organs. So in that organs, because here you see, this is again our abdomen, and here is the appendix. Small intestine, large intestine and appendix. Large intestine, small intestine, appendix. Now the thing is that in case of ladies, there is uterus here. From the uterus there are fallopian tubes, and ovaries. So uterus, fallopian tube and ovaries. Now problem with the ovaries, that the ovaries can get inflamed, and right side ovary getting inflamed, the pain will be here, and we may think this is appendicitis. The tube can get inflamed, so it is that salpingitis, what we call the inflammation of the fallopian tube, that we can think that appendix is there. Then again, in the reproductive age group, the ovum that grows, right? An ovum that grows, and when the ovum grows with the hormone inside the uterus, the membrane develops to receive the ova and the sperm for the baby to there. But when the ova is released from here, from the ovary, ova is thrown over here in the peritoneum. Sometime when the ova is there, the corpus luteum in the ovary that bursts and the ova is thrown. Some blood comes along with that. That blood may be minimal or may be more, and sometime we find this is quite a lot. And that blood collecting here in the middle of the cycle of the lady, menstrual cycle, that can cause inflammation here, and it can cause tenderness over here. In reproductive age group, this uterus, fallopian tube, embryo, ovary, this is appendix over here, and colon. They are nearby. Sometimes what happens is the ova goes from here and sperm comes from the uterus here, and the pregnancy, instead of being in the uterus, that forms in the fallopian tube. This is called an ectopic pregnancy. The fallopian tube is a thin structure. It is not able to support the pregnancy, the fetus. So it bursts open. When the fetus grows, it bursts. And when it bursts, then there is again blood over here. And sometimes there is lots and lots of blood. I have seen patients with all the tummy full of blood. Even the blood pressure of the lady may fall. She may become pale, or the pulse rate will be very high. But there can be less blood. And that can make a diagnosis of appendicitis with the lady's problems very difficult. Then again, now this is again appendix, and this is the uterus, and this is the fallopian tube and ovary. Now there is a ovarian cyst type of tumor, which is a balloon type of tumor. Now the ovarian cyst may be not diagnosed earlier. It can have various types of complications. Like there can be bleeding inside the ovarian cyst. There can be blood that can start collecting within the ovarian cyst. Or the ovarian cyst is like a balloon. It may twist. So if the ovarian cyst twists like that on its pedicle, its blood supply will go. The veins will stop at lower pressure. Artery will keep on pumping blood. So as this will be full of blood from artery and will become swollen, it will become painful. Or the ovarian cyst can burst due to injury or due to torsion. So this ovarian cyst, which can be big or small, can again make a diagnostic dilemma for us. So in ladies, especially in reproductive age group, we have to be very careful that patient may be having a pregnancy which she is having a natural abortion, or an ectopic pregnancy, or a swelling or inflammation of her internal genitoury organs like that of ovary or fallopian tube, or a complication of a tumor or a cyst of the tube. This is for the girls or ladies in reproductive age group. Second important differential diagnosis in this case is in infant and children. Now in this age group, the body lymphatic system is very much strong and reacts. So any infection anywhere in the body can cause a mesenteric lymphadenitis. That is the inside the abdomen. Again, we draw the abdomen. So this is the appendix here. This is the colon, large intestine, and here is the mesentery. Mesentery is the fatty tissue from where the blood comes to the whole of the organs of the abdomen. It takes the vessels to the liver, to the spleen, to the large intestine, to the small intestine. The vessels all go, and some vessels where the both sides are moving, like in small intestine, they are like a flap type of thing. So there are lymph nodes. So those lymph nodes get inflamed, maybe over here, and they can be tender. So we have to think that this may not be appendix. Now there is again a click in this. The click is that although appendicitis is not very common in infants, and very small age group, say up to 4 or so, but in this age group the diagnosis of appendix is important at an early stage, because if the complications take place, the complications can have severe repercussions. The death rate and severe disease because of the small reserves of the infant and children can be very catastrophic for the child. Another thing is that the omentum in the abdomen, I draw the abdomen again. This is the appendix, it gets inflamed. There is a structure, apron type of structure known as omentum. This is the large intestine here. It is hanging from this. So it is known as the policeman of the abdomen. So when the appendix gets inflamed, the intestine nearby and the omentum comes and wraps it. And as it gets wrapped, the infection is not likely to spread. In case of children, especially in infants, the omentum is not developed. So that policeman which will contain the appendix infection, even if it ruptures, is not there. So they are more likely to have these complications and more problematic, more important that we diagnose early. Another thing is any infection in them, even viral infection and others, worm infections, that cause tummy pain, vomiting. The patient's vomiting is very common with small problems, with fever. So pain, fever, everything can be due to small problems. Now the fifth is upper abdominal problems. So somebody is above, the problems can gravitate due to gravity. And I have seen this problem really when I was in Libya. There was a French surgeon from India, from Tamil Nadu, and he operated upon a patient for appendicitis. See, again I will draw the abdomen. And there is this colon, appendix, small intestine. and here is the appendicitis. Usually you will feel the sign and symptoms over here. But here lies the liver, gallbladder, and most important, stomach and duodenum. This is the intestine over here. Right? So, that case, actually the duodenum ulcer, the peptic ulcer had perforated. And as it perforates, the patient is up and about. By the side of the colon, the acid and other things, they trickle down. Rain, like rain falls down. Anything else, drop this pen, it goes down. They come down. And that fellow opened up and there was collection. But appendix he removed was normal. So then he had to operate above. And there was a problem. The people said, why you have done 2 surgeries? And then let them know about this, that this thing is documented in the books. And at that time, the people who were making problems, I was called at night to help him. And I explained to them. Then they agreed, yes, he has done the double work for you. But you see, perforation of the duodenum of the peptic ulcer, or perforation of a pus from the liver abscess, or that of a gallbladder, even pancreatitis. All these things may make the secretions come down by the side of the colon, right where the appendix is, and present like appendicitis. Number 4 diagnosis is with the urinary system. At times there can be confusion between the appendix or some problem with the urinary system of the right side. As we draw an abdominal cavity, kidneys are usually placed right on the back. So we place the kidneys right on the back. And from there the ureters come, the tube-like things that bring the urine diameter and goes to the urinary bladder to be discharged. Now here we are having our appendix over here. Which can be again long and lying close to the ureter or not. So either the appendix can be lying close to the ureter, or that the ureter may have a stone here. That stone has come from kidney down and stuck here. Now this stone here, or the swelling of the urinary bladder here, can cause a diagnostic problem. And this thing can present in the urine. When we examine the urine, there is some red blood cells. Now those red blood cells can be due to an inflamed appendix lying on the ureter, or a stone, a small stone in the ureter. One dictum is that there is some blood in the ureter, in the urine, and on the plain X-ray, no radiopaque shadow is seen, and signs and symptoms are that of appendicitis. You can take out the appendix. But the rare chance of a radiopaque stone which is not seen in case of plain X-ray, ultrasound may help. That you may find that the kidney is increased in size due to stasis of urine. And if you do investigation like CT scan or IVP, earlier CT scans were not available. Many times I had this dilemma. and then I had to order an IVP, and in the IVP the kidney will come non-functioning because it is obstructed and it is not functioning. The pressure inside the kidney is too much that the glomerular filtration is not taking place. So that non-functioning kidney will glitch the diagnosis that this is at that time. Now we have better modalities to clarify this error. Rarely the ectopic kidney can be there because the kidney in embryology, when the baby is in the tummy of the mother, uterus of the mother, this is below and this goes up. Sometimes it fails to go up, and any is more prone to inflammation. So it can get inflamed and you may have a diagnostic problem. Now in the end of differential diagnosis, I will discuss biochemical problems. So these are the problems like ketoacidosis, porphyria. These things they present with the diagnosis problem in diagnosis by abdominal distension, vomiting, and unless we are mindful and we are careful that other than appendix there can be comorbidities, or the appendix is not the problem, some other problem is there, or the other problem we are thinking is not there, it is due to appendix, that is inflammation. Even ketoacidosis can be due to appendix and appendicitis, or acute abdominal pain looking like this thing can be due to ketoacidosis. So in this differential diagnosis, we should now broaden our origin, remain aware and mindful of all the possibilities before we reach at a definite diagnosis. Thank you.